Hello, everyone. Today I'm going to share information about a success story from Afghanistan in an outline form. For more information, you can look up our website at familyhealthalliance.org. Some numbers: population of Afghanistan is about 30 million. The literacy rate is quite low, especially among women. It's about 18%. Urbanization is at about 30%, so majority live in rural areas. Maternal mortality is high, infant mortality is high, total fertility rate is high, and not surprisingly, the contraceptive prevalence rate is under 25%, about 23%. Context of this society: male-dominant society, men make the decisions at all levels. Now, what does this mean on the ground for women? It means that it doesn't matter how many clinics we build, it doesn't matter how many midwives we train. If these women do not have the man's permission to visit family planning clinics such as this one, they will not be able to go. Now, what happened after the US invasion in 2001? There was a major influx of resources. What happened in terms of health services? The Western-influenced, women-centered interventions missed Afghan men's potential and their vital role as advocates for women's health in rural communities. Basically, they viewed men as a problem. In 2005, we started our advocacy to implement a male involvement program for the first time in Afghanistan. We viewed them as an asset, we viewed them as contributors and as agents of change. This advocacy took place at all levels. We engaged all stakeholders, from the Ministry of Public Health to international donors to grassroots organizations on the ground. In 2007, we designed and implemented the first family planning program that involved men in Afghanistan. These are some of our trainees in a training program. This is the model. We trained health providers who are respected members of the communities in family planning and reproductive health. In turn, they educated men in rural areas to facilitate women's access to health services. I'm going to share some of the strategies that we used. I think some of you may already know that Iran has one of the most successful family planning programs in the world, and it's a research area of mine. You can see the numbers where Iran stands in comparison to the US. Now, two of the strategies that we utilized was their approach to Islam and family planning. We also took note of their strategies in involving men in the process, and they're very active in this area. Some of the other strategies that we used was we addressed the post-traumatic stress disorder among our trainees, and this is something that is mostly absent in development programs. Many of the people that we work with in developing countries have had issues with conflict and post-conflict societies. We also addressed violence against women and its relationship to health of the family and the community. This is also something that is not usually addressed in family planning programs, and we feel very strongly that, as we saw the previous panel, how important it is to have a comprehensive approach to this issue. In 2007-2008, we trained 150 doctors and nurses from 10 different provinces. We monitored them for 60 days, and they provided counseling to over 15,000 men in rural areas. We trained master trainers starting in 2009 to replace our team. We partnered up with the MOPH and the UNFPA, and we developed training manuals for the MOPH and the team. In 2012, this led to policy changes at the Ministry of Public Health. They began training on their own, and UNFPA provided the budget, including 2014, and this program, we feel, is a model that can be replicated and adapted to other societies such as Afghanistan, the male-dominant societies. Now, for more information, you can see our website. You could also view a film called Where Are the Men? This is a short documentary film. It's available online for free. It's 15 minutes long. You could watch it by going to wherearethemenmovie.com. This film, we made this film as a strategy to secure funding, and I'm happy to say that the strategy worked.